Welcome, everybody. We are thrilled to host this webinar. We're going to give folks a few minutes to log in, and then we'll get started. Thank you for those who are just joining us. We've got even more rolling in. We're going to give people a few seconds. I still see more people rolling in, but we're going to get started any minute now. Thank you again for joining our webinar on near-term actions to address workforce challenges and increase youth mental health access through digital solutions. I will be your host, Solome Tibabu, and as many of you know, this is definitely one of my favorite topics and absolutely one of my favorite populations. So thank you so much for joining us for this critical topic. As many of you are familiar, the mental health workforce shortage is facing huge challenges, and these are resulting in vast gaps in access to mental health services, especially for youth. And Medicaid, which insures 40% of children in the United States, is the largest payer for mental health services, yet many providers do not accept it, leaving over 60% of young people without treatment. To address this crisis, digital mental health tools can enhance the existing workforce by matching patient needs with provider expertise, enabling early identification and treatment, and facilitating outcomes and monitoring, as well as increasing patient engagement with evidence-based practices. These are all benefits of digital mental health tools and technologies that many of you have heard us discuss on webinars before, but of course, many of these things have just as many questions, which I'm excited to dive into today. And by way of background, for the last several months, our behavioral health tech team has been engaged in an exciting partnership with Meadows Mental Health Policy Institute, with support from Commonwealth Fund, about near-term actions to expand mental health services for youth through digital mental health tools. And today, I'm thrilled to lead a discussion with my colleagues at these two organizations about our findings from this report, again, supported by the Commonwealth Fund. Everyone will be able to access the full report and recording of the webinar after today's session, so be sure to keep an eye out in your email. You may also notice that at the bottom of the screen here, we've got a Q&A tab. We will have time at the end of the webinar to answer questions. Please feel free to drop in any questions you might have throughout the webinar in this little chat box, and we will be collecting them and answering them, as many as we can, at the end of the webinar. I believe that's it for housekeeping. And now, without further ado, I would love to introduce my panelists today. To get started, why don't we go ahead and have Casey Kelly get started from left to right, and we'll have you each introduce yourselves.
Thanks, Solome. I'm so delighted to be here. My name is Casey Kelly. I'm the Chief Innovation Officer at the Meadows Institute. I've been working in mental health care policy and operations for about 22 years, and I served as the lead of this small and mighty team. And we're just, like Solome said, really thankful for the support from the Commonwealth Fund and really excited to share the findings of our work with you today.
Lindsay?
Hi, thank you, Solome. Also very delighted to be here today and to talk about this topic with all of you. My name is Lindsay Engelman. I'm the Assistant Director for Innovation at the Meadows Mental Health Policy Institute. In this role, I lead research projects around quality behavioral health care. And my previous role most recently was at the UT Dell Medical School, where I worked in a program that was working with Medicaid managed care organizations to pay for community interventions that were impacting social determinants of health, and to figure out how to get those paid for by Medicaid.
Rachel, why don't you go ahead? I'll be last.
Hi, everybody. Good afternoon. I'm Rachel Newsom. I'm our Senior Vice President for Policy at the Commonwealth Fund, where I also get to co-lead our behavioral health initiative with my colleague, Reggie Williams. And we're just really thrilled to be here, be part of this work, and have a really informative conversation about the policy levers that are available for us to use right now to really think about how digital mental health tools can be optimized to really help ensure enhanced access to equitable behavioral health services. So thanks for having us.
Fabulous. And for those who haven't joined us on these webinars before, I'm Solomé Tibabu, the host and founder of Going Digital Behavioral Health Tech, which is the largest community focused on expanding access to mental health and substance use services through tech, health equity, and innovation. And in addition to that, I'm also Senior Fellow for Digital Transformation at Meadows Mental Health Policy Institute. And this project was such an eye-opening, incredible experience, and I'm really excited to dive into some of our findings. We'll try our best within the small time frame relative that we have for all of the juicy work that our teams have done these last couple months. And so without further ado, I might just jump into our first question. Let me start with Casey. So we all know that the mental health crisis is at all-time highs right now, especially with the new Surgeon General advisory. But can you tell us a little bit more about what you're seeing and the impetus for the entire thing here?
Yeah, thanks, Solomé. It really came from a place of, realizing that in sort of my whole career, I haven't seen as many people talking about mental health as they are today, and many different types of stakeholder groups that historically was not really focused on mental health. And so it came from a place of like, how do we actually capitalize on this renewed, or I would say increasingly aware stakeholder group, so that we can actually maybe do something about it and generate some solutions. And there are lots of folks that are, I would say, focused on the youth mental health challenges and really thinking about where those workforce solutions might be. But the large majority of them, from our view, were really aiming at things that were going to take some time to be able to deploy and utilize. And so we were really curious about where there might be opportunities for this administration to take action in the near term, because they're clearly committed to this problem and trying to figure out how to advance some solutions and offset the trajectory that we're on. And so we really wanted to look at those near-term opportunities that could help put us back on a better track.
Oh, yes. And, as you're talking, I'm reflecting back on just my learnings throughout this experience. Of course, Meadows Mental Health Policy Institute and Commonwealth Fund has been steeped in policy and advocacy work for a long time. But, at least for me, this project only furthered my excitement and confidence around the power and leverage we can have with policy change to really expand access to tools that are readily available. As you said, we talk often about the crisis, but we've got tools now that could be in the hands of youth, and so very exciting stuff.
And I'll just add something. I think the thing that we had lots of conversations on, but to clarify for the audience, is again, there's a number of initiatives really looking at the legislative opportunities that need to happen, but those are going to take years, if not decades, to actually be able to realize. And so we really thought there might be an opportunity to look at where there's existing authorities that maybe had driven innovation in other parts of healthcare that just hadn't been applied to behavioral healthcare, that we could identify as opportunities to help solve the crisis.
Yes, really good clarification. Now, Lindsay, let me turn to you. Could you talk about what were some especially important aspects of this project that you wanted to ensure were baked in throughout the process?
Yeah, sure. We really wanted to, from the very get-go, center health equity in our process. And that is really kind of how we came up with the focus of this process. So very foundational with focusing on Medicaid. It also just made a whole lot of sense. Nearly 40% of, as you mentioned, of our youth are insured by Medicaid. And we know that a large number of them are youth of color or youth living in rural areas or other youth that experience different kinds of health disparities. So we feel it's really important to focus on this population, one, so that they can have the access to these tools that Salome and Casey have both mentioned. And also we know that there needs to be viable financial pathways for innovators to actually focus on innovations for this group. So we kind of have to start with sometimes the financial piece in order to get to the health equity piece. And that was really important for us.
Yeah, two really important aspects, ensuring that solutions are a good fit for all youth, but also for the innovators, which, as many of you know, Going Digital Behavioral Health Tech is made up of a lot of innovative, novel new digital health companies, helping them have some understanding of navigating the financial incentives to be able to accelerate the scalable tools that they may have. Now, Rachel, let me turn to you. As I know, the Commonwealth Fund is building your first portfolio around behavioral health. Why was this particular topic a promising area of interest for you?
Thanks, Salome. So this is a newer area for us. We launched our special opportunity area in behavioral health in 2021. And, for folks that are not familiar with the fund, we are very focused on policy analysis and policy solutions, identifying places where the evidence is strong, and then helping to translate that for policymakers at the federal and the state level. And to Casey's point, when we started out, we track trends in health outcomes. We look at things that, compared to other countries, we look at, state by state comparisons. Anywhere you cut the data, we are on a really unsustainable trajectory when it comes to behavioral health indicators. And not all populations are faring the same. We know that, as Lindsay mentioned, populations of color, youth are particularly struggling. And that all kind of came together in 2021. And we said, how can the fund really help to amplify and accelerate policy change in this space? So not looking to recreate the wheel, but really looking to say, where do we have policy connections? Where do we have connections as they relate to how we pay for care that's covered, and how we design the care that's delivered? So our healthcare coverage and access program, our payment and delivery system reform program, our international program for comparisons, our tracking work, in so many areas, this just was a perfect fit for our area of emphasis. One of the things that, as Lindsay mentioned, was really key in all of our behavioral health work was to center equity and to make sure that we were talking about ensuring access to equitable healthcare services. And for folks that are working in behavioral health, this idea that we don't have a supply that's of providers that's well positioned to meet the need is one we hear over and over again. And like Casey mentioned, a lot of the solutions are a long time down the road to recruit and retain and train new providers. The exercise here was to really say, okay, focusing on this really vulnerable population of youth and youth that rely on Medicaid for their coverage, what do we have access to right now under existing authorities that the administration, if they chose to, could really look within the different agencies for opportunities to align the way that we're providing care, how we're paying for care, and identify barriers that we might be able to remove, or identify things that might be able to make it just a little bit easier for people that are really struggling to kind of figure out how to access care in this very sometimes chaotic, patchwork of coverage that we have here in the country. So I think all of those reasons, for all of those reasons, this was a real exciting project for us to take on. Thinking about, the role of technology is just first and foremost, what is so pressing and timely for right now. Targeting youth, thinking about the role of Medicaid, as you already mentioned, the number one payer for behavioral health services and provider for behavioral health services, and really staying grounded in the equity component. So lots of reasons, but we're really excited about the project and what you all uncovered.
Well, thank you for your partnership, Rachel, and of course, all of the amazing work that the Commonwealth Fund has done. Casey, let me go back to you. I know you started talking a bit about specifics of the aim of this particular initiative, but maybe you can shed a little more light on that as we dive in on specifics.
Sure, I'm happy to. I think the area that we really wanted to dig in a little bit is on those tools that have a strong evidence base that we can consider evidence informed, that could perhaps bolster our existing workforce. While there's been just a proliferation of digital mental health tools out there, there's also a lot of concern about whether or not these are quality and what even quality digital mental health means. And there's a ton of work to be done there. So I will not debate that at all. And we also really wanted to see, in the spirit of what are all the tools that we might have available in our collective provider toolbox and our digital toolbox to use in order to help us address some of the challenges we're seeing related to workforce and access. And so we wanted to sort of narrowly focus in on, as we begin to dive into this world of digital mental health technology, people talk about it as if it's one thing. And as we began to advance our research and really understand the scope of this project, we really began to understand what are the different types of digital mental health tools, what were they designed to do, how could we really identify the ones that were most ready to integrate into the workforce to help our busy clinicians do their jobs more effectively and more efficiently. And Danielle, if you can pull up, I think it's slide 8. I just want to show the audience like some of the categories that we were looking at. And in an effort to try to make sense of the depth and breadth of what the opportunities were, we broke down the tools ranging from what we called telehealth plus, meaning telehealth that's really backed by data science and helps with some of the matching of expertise versus a patient need, all the way down to those self-guided digital mental health tools that I think oftentimes people most think about when they hear technology or they hear apps, and then everything in between. And we really honed in on 3 categories of tools that we thought were most ready to have the conversation about deployment and acceleration of adoption. And so that's that telehealth plus that I referenced, the tools that help our clinicians with screening and measurement-based care, and then those tools that help our clinicians deliver interventions, but are still supported and coordinated by a human, clinician care. And Danielle, we can go to slide 9. And so in sum, where we really landed, in addition to those 3 categories, was the ones that we felt like were most ready for deployment were the ones that could be used in conjunction with clinician care. Those that have a strong evidence base behind them and could be considered evidence informed, such as those tools based in cognitive behavioral therapy or dialectical behavior therapy. And then also sort of look at those actions and policies that the executive branch could take in the near term. And so I just want to like have everyone focus on these are the kinds of tools that we're looking at for these recommendations. And these are the existing policies and regulatory authorities that we're really aimed at in this project.
Perfect. Thank you, Casey. I think that's really important given there's such a huge universe of digital health technologies, but this is specifically the subset that we're focused on for this project that could have the greatest impact and leverage for these mental health crises. Now, let me, if I could turn to Lindsay now, can you talk a little bit about how you went about understanding, or how I guess all of us went about understanding the opportunity, where the opportunities might be?
Sure. So we interviewed a number of people, and we started with academic experts in the field to kind of get a lay of the land. And then we interviewed quite a number of industry experts, particularly leaders in the Medicaid managed care space, former Medicaid directors, and then finally we honed in on a handful of government, federal government offices to interview.
Now, speaking of regulatory, can you help us dive into a little bit about some of these research findings? And we've got regulatory research findings, we've got reimbursement. Maybe we'll just start with regulatory.
Yeah, sure. On the regulatory side, we're mainly dealing, at least from pre-market perspective, with the FDA. The FDA is the main agency that's charged with ensuring the safety and effectiveness of various products. And to its credit, the FDA has done a lot of work to advance the digital health and how it will review that, because it has been fairly tricky for our government agencies to deal with. But the reality is even though they have done a lot of headway, the vast majority of mental health technology is not actively regulated by the FDA. So this leaves like this huge space, like tens of thousands of apps that are not being regulated. And then the problem with this is that clinicians and consumers are really left kind of in the wild, wild west of like not knowing what tools are out there and available to them, which ones are of high quality. And so this is in terms of kind of their impact on mental health, but also in terms of safety in regards to privacy and data security. And there are really large gaps in regulation in those areas as well.
That's a really good summary of a lot of information that we went through. And now, how about on the reimbursement side? I understand that, things can be fuzzy for digital health companies to understand in the same way that, consumers, providers are struggling to navigate the regulatory and quality issues and reimbursement. What about the entire reimbursement problem?
Yeah, certainly. This is certainly fuzzy for innovators and companies who are trying to navigate reimbursement, simply because there just like really isn't straightforward mechanisms for a reimbursement, particularly in the space of public insurance. There's a couple of reasons why it's really tricky for digital mental health technology to be reimbursed. The first is kind of falls into that digital mental health technology doesn't quite fit like the reimbursement and coding system, right? So it is a little bit of a service and it's a little bit of a device. And normally our reimbursement system has those in two different categories. So it's been throwing regulators or people in the reimbursement agencies off CMS. Similarly, like we normally reimburse, but based on who delivers something, where it's delivered, all those types of things can be really varied for digital mental health technology. The second area that makes it really difficult is that just how fast digital mental health technology can be produced. So it is evolving quickly, it is updated constantly, and this is coupled with a research process that reviews evidence that is really slow. And so that has been really difficult for both federal and CMS and state Medicaid authorities to deal with. So CMS, when we're thinking about Medicare, while that doesn't directly impact Medicaid, it's a really important precedent for all payers, including Medicaid. And CMS has really struggled with this issue. It has made some recent headway coming, and it's currently rolling out a coverage with evidence development process that provides some promise. And then states have also been struggling. There have been some states who have covered specific products, some states who have come up with new coverage determination processes to figure out a more streamlined way of evaluating digital technologies for coverage, Medicaid coverage that hold some promise as well. But overall, states are still really struggling with this. And I should add that so is Medicaid at the federal level. That they have not quite figured out what authority to fit digital mental health technologies under.
Wow. Well, this is eye-opening, but also sounds like an opportunity for a lot of innovation, me being the optimist. So yeah, I would love to talk about solutions. Did you find anything that might be a viable way that the executive branch could do some things in the near term to support the adoption of digital mental health, particularly on regulatory and reimbursement sides?
Yeah, we did. Certainly, a lot of this will have to be managed in the long term, and there's like a long haul, but particularly with the focus that we had, focusing on interventions that have more evidence based, and we can consider evidence informed or based off of more digital translations of tools like Casey was talking about, and that are used in conjunction with clinician care. We do think this opens up some opportunities for the near term. From the regulatory side, thank you, Danielle. From the regulatory side, really the thing that we feel that can impact all these things you see here on this slide, safety and efficacy, privacy and data security, data sharing and interoperability, we think the first step that will be foundational is creating some clarity around the different types of digital mental health technology and standards and guidelines for within each of these areas you see here. And we think this could really be done in a private-public partnership to help define these pathways so that they're as clear and make as much sense as possible. And we don't necessarily think that this would lead to more FDA regulation, but the FDA could just support a process of providing clarity in this space of all the many tools that are currently unregulated.
Wow, super eye-opening. Thank you for these categories. It's helpful that to summarize here, we've got safety and efficacy, privacy and data security, data sharing, interoperability for regulatory. Now, what about on the reimbursement side? What kind of opportunities can we highlight for our audience for reimbursement?
Yeah, sure. Similarly, there are opportunities on the reimbursement side. And again, I want to remind everyone that we are looking here at tools that are used in conjunction with clinician care. With that, we kind of can open ourselves up to really understanding what codes are already out there that we might be able to tap into and utilize to enhance payments for digital mental health technology. So one of the areas that we really see that the most opportunity in is really leaning into measurement-based care. So for people who don't know, measurement-based care is the use of validated instruments like the PHQ-9 or the GAD-7 being the most common, the use of those instruments to screen and monitor patient outcomes over time. So those have codes, those can be paid for. And so we think there's similar opportunity in other places. We also think there might be opportunity for enhanced payments by reviewing where rate calculations can take into account digital mental health technology, or where there can be add-on codes in specific situations. And then finally, there's a number of opportunities within the Medicaid space. Perhaps the most common thing we heard in our interviews was about the possibility and opportunity for innovation within the request for proposal process. This is an opportunity where state Medicaid authorities can put an emphasis on addressing youth mental health, and then in finding innovative solutions, and digital mental health technology could be an important piece of this. And on Medicaid managed care organizations can decide on their own to make themselves stand out in that way, even without the state kind of putting that out towards them. Like I mentioned earlier, there are a few states in Louisiana and Washington have been the strongest examples up to now of who are developing their own evidence coverage determination processes. And that is something that we should all be watching and learning from. And I think I actually already mentioned this, that Medicaid MCOs can also take this up on their own and put this in part of their request for proposals.
Fabulous. Thanks, Lindsay. This was a great summary, both on regulatory and reimbursement challenges and opportunities that we came across. I want to remind all of our attendees, remember, we'll save some time at the end for questions. Go ahead and drop any and all questions that you might have into the chat box, the Q&A tab below, and we'll get to as many of them as we can. All right, so let me go back to Casey. Maybe we can pivot into what kind of, in terms of what the research had identified that we found, what kind of policy recommendations are we suggesting?
Thanks, Salome. And Lindsay, thanks for the helpful summary of the findings, because I think this project, we have learned so much just about the various roles of the different agencies and how there isn't a single agency that owns this problem or owns the solution. And so we identified recommendations across a number of the executive branch of the federal agencies within HHS. The majority of our recommendations really falls under the first column for CMS. Again, we think that targeting the reimbursement opportunities that CMS could help lead would really go a long way in helping states understand how they could leverage these types of tools to bolster our Medicaid workforce across the country. And as Lindsay referenced, some states are already leaning into this. And so we really saw an opportunity for CMS to issue an informational brief. They've done this in the past and sort of have a operation already in place for issuing informational briefs so that Medicaid offices around the country really understand how some states are beginning to integrate these tools into their services. And so more states can really understand where these opportunities exist and how they can help clinicians who are serving our youth through Medicaid perform screenings and deliver on some of the requirements for measurement and screening. I would say in our recommendations, we specifically recommend that the informational bulletin outline the existing financial pathways and highlight that digital tools can really help states fulfill the requirements for early and periodic screening, diagnostic, and treatment. That is an authority that's already in place, but we have heard that states are really struggling with being able to execute on that because of the workforce limitations. And so here is an opportunity tools. We also identified a couple of states that were using the RFP procurement process to encourage these types of tools and innovation, and there are ways to do that so that it's not a one company take all type of procurement. And so we're recommending that in this informational bulletin, CMS include those kinds of examples for more states to leverage and realize. And then in support of the informational bulletin that could clarify these pathways, we're also recommending that CMS develop some learning collaboratives so that states that have a little bit more experience can share more readily, more easily with other states to help with implementation of the informational bulletin. And so we're really, really hopeful and excited about that first recommendation. The second one is really calling, Lindsay mentioned in our findings that there's a lot of confusion about what people mean when they say digital mental health tools and where they fit in both the regulatory and reimbursement process. And in the existing FDA regulatory authorities, most digital mental health tools fall outside of that. And so we're recommending that FDA, the Office of the National Coordinator, and SAMHSA really work together and partner to create some definitions so that our entire community has a better understanding about the categories of digital mental health tools and a clear understanding of which tools fall within and which tools fall without the regulatory processes. We think that would actually go a long way in facilitating the sort of next conversation around safety and quality and appropriate use. We really do believe that if we could get greater precision in the depth and breadth of these types of solutions and publicize them from the federal government's perspective, that would really help the community better understand which pathway to follow and which guidelines were relevant to their solution as part of integrating into the system. And then finally, we're recommending that ONC really take the lead on developing our data security, interoperability, and privacy standards. We've been talking about this need for, it seems like, over a decade at this point in behavioral health care. And we're to the point where we really can't wait any longer to take action. This is definitely a longer term process, but we need to get started with it. And so we're recommending that ONC, as part of their stated priority of behavioral health, take the initial steps and coordinating across the other relevant agencies and pull in those private sector industry experts as appropriate to help inform the process and really start moving us in the right direction on data security and interoperability. And then, as we've talked about in several instances on the webinar, other people have, we really want to see these actions be rooted in the population that we're trying to serve. And so integrating youth of color along the way, youth and underserved populations along the way with every part of these recommendations, so that we make sure we're creating solutions that actually will help the customers most in need that we're aiming towards. And so we would really like to see the executive branch and the administration start moving out on these recommendations in the near term, and look forward to seeing how we can continue to support the effort.
Yes, again, just like I said to Lindsay, that was a great summary, Casey, of our recommendations and findings that we spent the last several months working on. And I think overall, this will add a lot of clarity for all stakeholders, and it's a nice first step. But Rachel, let me ask you, I'll hear from you. Where do we go from here?
the million dollar question, the billion dollar question. Well, I just want to emphasize, I think what really sticks with me after hearing Lindsay's, data findings and also Casey's policy recommendations is that oftentimes one of the most valuable things the federal government can do is send clear signals. And for the entire audience that's focused on innovation and digital health, one of the things that really works against innovation is uncertainty. And so not knowing what's allowed, not knowing what might potentially have to go down one regulatory pathway or another, oftentimes it is just not worth it for providers or organizations, let alone patients. We're not even talking about, a technology that a patient might find on their own that they may be trying to use. Having that certainty and having signals that are clear and understandable sent by the federal government can go so far to get us started. It's not all we need to do, but I definitely just want to underline how critical that is. And the coordination between the different agencies that, so many agencies have a role in the behavioral health space. And I love the comment that it's not one agency that's going to come up with a solution on its own, and how important that kind of intragovernmental collaboration is to really get this done. And then Salome, to your point, I love the fact that equity is cutting across all of this. I think if we've learned anything over the past 5 years, it's that, working on these solutions in a vacuum without our targeted population sitting next to us in identifying what they would need to really make those workable, and helping to craft the policy solutions is really critical. So I'm really energized by this. I think, we need a mix. This doesn't just apply to behavioral health, but in kind of any policy area we're trying to accelerate or advance. We need some short-term things that we can do with the authorities that we have. We need some longer-term kind of stretch goals. And there are certainly efforts underway in Congress on a bipartisan basis. There are tremendous efforts at the state level. This is just a fraction of them, where the states have been saying for years, this is our top priority, and at the local and community level as well. So this is it's one critical step. I think every time we talk about workforce, we should be asking ourselves, how can we optimize the current workforce that we have? How can we really support those providers to really, any provider that's working in the space wants to meet the need of their patients, right? And so this is really about connecting the providers with the tools that patients will find compelling, that they will use, and really connecting that provider or that patient voice into that discussion. So I think there's lots of exciting opportunities, lots of time to get into the different roles and the regulation and how we reimburse. But I just think this is such a critical first step to just clarify some of these categories, speak with a really clear voice to the private sector partners, to the states and to their Medicaid agencies that can then talk to their managed care plans, and just more clarity is going to help get us where we need to go.
So well said. Absolutely, Rachel. And Casey, let me ask you the same question in terms of where do you think we're going from here?
Thanks for that, Salome. And like, I just echo everything Rachel highlighted. We are hopeful that this work will help us as a community really understand what are those first steps that we can take. And I think we're at a place where we're not asking the question about whether digital tools will be part of healthcare, and more asking ourselves which populations will have access to them. And that is something that Lindsay actually said to me earlier in the project, that like I think about every day. How are we actually moving forward recommendations that help those people and those youth that really need it. And I think I would just also offer, and having worked in government for 15 years, like, I know this is hard, but like, we spend so much time and energy thinking about the risk of action and whether or not we have enough data and whether or not we have enough information. And I just hope that our leaders will also be thinking about what is the risk of inaction at this juncture. And I hope we as a community can continue to think about the balance of making sure that we're advancing recommendations that are safe, but also thinking about how are we making sure that our discomfort as leaders isn't doing more harm than good, and really lean into the risk of inaction.
So great. Both of you have emphasized, or at least what I heard, is what a critical point in time for us to have a huge impact. And so I'm grateful for everyone who could join us and be part of the solution as we work toward that. Maybe I can sneak in one more question before we go to Q&A. Thank you, everyone. I see lots of questions pouring in. We'll get to as many as possible, but I'd like to ask you, where can folks learn more about both of your organizations? Maybe Lindsay, where can folks learn more about Meadows Mental Health Policy Institute? And Rachel, I'll ask you the same for Commonwealth.
Yeah, you can learn more about us on our website. And I think Solomé said at the beginning that she'll be sending out an email that will have a link to our website where the paper will live, and also a recording of this webinar.
Thanks, Solomé. You can also find our resources at thecommonwealthfund.org. Specifically related to behavioral health, we have a lot of resources on Medicaid, Medicare, integrating primary and behavioral health care, the importance of ensuring equity is embedded in all of the work. And to be clear, we are, we're still learning in the space, and we are, identifying areas where we can amplify and accelerate work of our peer organizations as well. I saw one very quickly question in the Q&A box about how we involve our target populations in the community and the developing of policy recommendations. And I love that question. We've got work with Jamila Mishner at the fund. She's at Cornell, and it's not specific on behavioral health, but she has a whole framework, and I'm happy to include that in the resources for just ways to think about whether or not a policy has been imagined and crafted and implemented and evaluated in an equitable way. And I would encourage folks who are interested to take a look at that. We're also trying things like having youth and family councils and advisors built into projects, and really as a funder, asking ourselves, what role can we play in, making sure that the voice of the target populations are really embedded in the policy. And for us, we can require that that's a really key part in the projects that we fund, such as this one, making sure that, you guys are not only talking to one group of experts, if you will, but that there's a well-rounded group of perspectives involved, and folks who have kind of either lived experience and or experience working closely with the populations that we're talking about. So I just wanted to, if we've got extra time, we can talk more about that, but I just wanted to let people know that we're still very early in our journey, but those are a few of the things that we're trying so far.
Awesome. That was a great segue, Rachel, into Q&A. Thank you. And Bridget, hopefully you caught that. Rachel answered your question, weaved it in there. But of course, Casey and Lindsay, feel free to chime in on if you have recommendations on how to engage patients in the innovation and policy development process. Otherwise, let me pull up our list here. Okay, let me try to go in order here. Anyone want to take, what can organizations do to help at this time in terms of pushing legislators or awareness?
I can start. I'm sure Rachel has thoughts about this as well. Well, like I said at the beginning, like one of the most, I think, exciting parts of where we are in this juncture is that lots of different organizations are realizing that we, as a mental health community, really do have to figure out what we're going to do related to digital. And so if you are a member of the American Psychological Association or the American Psychiatric Association, if you're a provider, like those organizations are putting out public statements pretty regularly on where they stand on these kinds of solutions. Other nonprofits have also been stepping up to try to advance answers on what does quality digital mental health tools, what should that include from a consumer or a provider to help our community better navigate and be more informed about what types of solutions are better than others on a variety of different pillars. I would encourage you to check out the One Mind Cyber Guide. For example, the American Psychiatric Association also has a digital mental health tool component of their website that's really informative. And I think the call to action right now for the provider community is really just to try to be informed. And when you have an opportunity to educate your local political officials, to just be as informed as you can be, so that you help them understand why you, as part of our solution workforce, are looking for these kinds of solutions in order to help you operate at the highest and best use of your license. Rachel, Lindsay, other ideas?
I agree with all of that, Casey. I would say, again, this applies to lots of policy issues, but thinking if you're going to take action and talking to policymakers, just breaking it down into a couple of categories. What are the things where they have authority right now, where your state Medicaid director could act right now, or where the administration could act right now? That's a very different conversation than something that might take additional legislation to grant them the authority. I'm going to go out on a limb and say we probably need all of those things happening at the same time, but breaking it down so we're clear who we're talking to and why is really critical. We have to know, we have to have that baseline information around what authorities they do have. So kind of arming yourselves with those pieces of information, I think will make it much more compelling to then be able to talk to the audiences that really have the power to really think about and make changes based on your recommendations.
Excellent. Rachel, since maybe you'd be good to take this next one. I see Molly, thank you for your question. Sounds like in terms of timeline, particularly state legislators that will benefit, will you include a potential timeline for action so that they can identify opportunities to act within the next 2 to 3 years? Maybe speaking more generally, like what's the timeframes for these kinds of things?
Yeah, thanks, Molly. I think that really gets at the heart of what I was trying to say. There's a big translation. I mean, this group has done the research, right? And there's a really role for everyone in kind of translating, therefore, what does this mean and who does what next? State legislators need a very different translation kind of plan than a state Medicaid director, than a member of Congress who might sit on a rural, caucus who's focused on digital behavioral health. So just getting really clear who our audiences are, and I use the royal who and the royal we here. At the fund, just to give you some examples, we've got partnerships with the National Conference of State Legislators. We have partnerships with the National Academy for State Health Policy, both, and the Medicaid directors. All three of those have some activities underway related to behavioral health. So making sure that's really our role at the fund, making sure that some of the nuggets and the findings from this work can then get shared with our partners who are on the ground, and they know the timing of all of the legislative sessions. They know when bills have to be filed. They know when the governor wants, the big ideas so that they can draft their budgets. And, one other thing I want to point out is that, states are at different levels of readiness. And so we've got a learning collaborative with the National Academy for State Health Policy, where there are 6 states who are working really actively right now to think about how they can reform their behavioral health system, really make use of all of the different federal resources that are out there. And this is, one small part. It's a critical part, but it's one small part. So again, focusing on that translational activity, the timelines are going to be different for each state, and the federal timeline will be slightly different than the state timeline as well. But, looking at the managed care contract timing, there's a lot of different things that could impact timing for a state. But just having those partners so that we can do the translation really effectively is really key.
Fabulous. Let's see, we could probably do 1 or 2 more, maybe 2 fast ones or 1 long one. One of the issues for digital therapeutics is the evidence base specifically on the question of whether people can continue to use it. Can you talk about how you would address this in policies you recommend? Lindsay?
Sure. So this isn't, I can answer this question in part, and it's really was outside of the scope of our work, and we do not have any specific policy recommendations. However, there are people who, particularly some of the academics we spoke with, who have some suggestions on how to handle this. One of them is when doing randomized controlled trials, that instead of comparing to a group that has nothing, to ensure to compare to a group who has something. That kind of deals with the placebo effect, which is sometimes what people think is happening when there are positive outcomes in really any studied intervention, but including digital mental health. And the second is, that there are some people, and I would call out Stephen Schuler here, who is the executive director of One Mind Cyber Guide that Casey mentioned a little bit ago, who is really advocating for studies in the real world, is how he refers to it, so that you stop doing these long randomized control trials and actually start doing studies more out in the field, so you can start understanding real life uptake more quickly. I couldn't speak to the specifics of how that's done, but I know he has a lot of work out there that could outline that for you if you're more interested in that.
Excellent, thank you. Yes, we're a huge fan of our friend over at One Mind Cyber Guide. Wow, where did the time go? We have a lot more questions. We'll be sure to capture all of these and follow up with each of you that we didn't have enough time to get to. I want to have an opportunity to thank everybody for coming and learning just a little bit about this exciting project that the Behavioral Health Tech team was able to do with the Commonwealth Fund and Meadows Mental Health Policy Institute. And of course, last but not least, thank you so much to my amazing co-panelists for sharing your expertise today. Thanks so much. Without further ado, check your emails for the recording and the paper. Have a great afternoon, everybody.
Thank you.